So shoulder issues or shoulder problem, there are multiple cases are there. Like, it's not a single case, it is a syndrome. So many things come together to become a shoulder issue or a shoulder problem. So mostly, what we are hearing about, shoulder instability, the pain, why the patient is lifting, is in what patient is complaining about. So mostly in clinically in according to internal medicine, so we can categorize the shoulder pain to different type of, maybe it is a bursitis, maybe it is a ligament sprain, maybe it is a muscle strain, so we already heard about frozen shoulder, adhesive capsulitis. So these are actually, adhesive capsulitis or something like that. It won't happen in a day or something like that. So slowly, it will become that adhesive capsulitis. So we have to know where is the root cause and how this happened. So this is 100% sure that that adhesive capsulitis is not, or frozen shoulder not happen in a night or in a day. Okay, so it is a gradual progression of the problem that leads to the adhesive capsulitis. Okay, and in this, there is one more thing, rotator cuff injuries. So rotator cuff, there are four muscles in the shoulder. So we have to know. So first of all, the treatment, the patient coming to us is a pathological, is the patient is in a pathological state. So that means not in a normal anatomical or physiological state. So they become a pathological. So what our clinician duty is to change the patient from the pathological state to the normal anatomical or physiological state. Okay, so especially why, so the major thing what we want to know is the anatomy, physiology, and biomechanics, and the pathology. Okay, so then only we can understand how to change the patient to normal physiological state. So we must know what mechanism of injury. The major thing is, the mechanism of injury, the how the injury happened. It is a gradual progression of the progression towards the injury, or it is a sudden injury happen. So whatever happened, the body will respond in. That is the normal pathology, and later on the condition will generate. So major thing is, we should know, as I mentioned before, the mechanism of injury. So if we know the mechanism of injury, we have to walk towards the normal. So from the mechanism, so we should know the why this injury is happening. So it might be a decentration of the muscle, or it is a decentration of the bone also. That means in the joint space. In the joint space, how the view people can ask how a degenerative changes can occur in a muscle. So if there is a continuous pull over a muscle, that is the eccentric pull, not a concentric, very in concentric. There is in the concentric contraction, the muscle won't get injury. The muscle injury always happens with the eccentric injury, eccentric pull. So if there is an eccentric pull, and that is above the limit, so that happens a muscle strain, muscle strain, and that can cause, the muscle strain is nothing but a microscopic tear, and if it is for a long time, so the degenerative changes will happen. So there is a permanent damage of the muscle. So that is how it happens. So if it is, so there's a partial tear. So according to the muscle tear, there's the division, partial tear, and full tear. So that also we done mention. So sometimes, the covering of the muscle fascia, everything will be there, but the muscle fiber only will there. So there are a lot of different type of injuries out there. So most important thing, we can't heal the injury. The dealing is done by the body itself. We are just facilitators, just facilitating the body to heal fast. But most important thing is healing should be in a right way. Means the muscle tension should be correct and the bone alignment. We are positioning the bone according to the normal anatomical position, in the right anatomical position, so the healing will be good. Healing for what? The soft tissue. The soft tissue like muscle, the ligament, capsule, and everything. So with that anatomical position, the movement should be initiated. So if the most of the time, what wrong is happening is, most of the time, whenever we are doing something, whenever patient is coming, we are asking the patient to do the exercise. But if it is in a wrong anatomical position, the exercise won't work. and exercise will become bad, and that can cause more injuries. So we heard that most of the people, when they're doing exercise, they will get more injuries, and the case will become worsened, because this is because of the wrong anatomical portion. Because of the wrong anatomical portion, there will be a continuous pull over the soft tissue. So there is no use. So the condition from the acute case, it will become subacute, and then it will become chronic. So better, we have to correct the anatomical portion. Once the anatomical portion is done, then we can go to the exercise. So make sure the joints are in the right anatomical portion. So this is the evolution. This is the evolutionary change has happened in a shoulder joint. So while doing like a treatment also, we have to make sure that before patient is leaving of the clinic, we have to make sure that patient is in an anatomical portion. And especially we should mention that that area should be take rest, enough rest, which especially shoulder. Why shoulder? Because shoulder is in an open kinematic chain position in a resting state. But especially we can compare the shoulder and the knee joint. Okay, the knee joint, while standing, it is not in an open chain, it is in a closed chain. So there is no pull is happening, there is no muscle pull is happening in the knee joint. But in a shoulder, as we learned the biomechanics, if there are two types of things, first in biomechanics we will learn about the anatomy, and then about the resting biomechanics in the resting state, and biomechanics in the dynamic state. Okay, so in the resting state, also the muscles are working, especially the rotator cuff muscle, the deltoid, all these muscles are working. If the rotator cuff is not functioning well, if a rotator cuff bone injury because of the shape, the front part, the shoulder girdle came over like this in the swooping posture. The rotator cuff is continuously that is getting the pull, that is the pull. So that is an injury. So the stability of the shoulder to keep in its right anatomical portion is losing, and because of that, an injury is continuously happening. So while patient is sitting in a resting mode, by sitting in a chair or something like that, and the infrasmanoid is minor and subscapularis, these muscles couldn't be able to hold the shoulder in the right anatomical position. So what will happen? There will be a pull over the deltoid and also the upper traps. So if the deltoid should be strong enough to hold that, otherwise the deltoid will get hurt. Some people are complaining that they have a resting time also. They are getting a pull over the deltoid muscle, anterior deltoid and middle deltoid. And some people, they will tell they have a pain over the upper traps, because that also get involved. So if the deltoid is not working, upper traps will start to work more. So if the upper traps is working, it is attached. There is a origin of upper traps from the cervical area. So there will be a pull over the cervical vertebra, and the cervical vertebra also will lose its anatomical position. So if the cervical vertebra loses anatomical position, then the disc bulge can happen. So there is an impingement of the nerve there, and there will be paresthesia, nerve issues. In the nerve is compressed, all the sensation and the motors will start to affect. So this is how the evolution of injuries. So shoulders, we cannot say it is a particular condition, it is a syndrome. It is a combination of condition. So this is about the shoulder in general. So now we will go specifically according to the conditions. Okay?